On Matters Health, and we are discussing pediatric first aid. Very, very important for a majority of people out there. I hope you can give us your ears, your eyes as well, because then we'll be having some demonstrations to do, but most importantly have your pen and paper. It's something that you can understand in such a short while, but will come in handy to make sure that you save a life, that life of that little child that you will be close to in the event of an accident or in the event of an occurrence that will not be so beautiful to see. So Andrew Anjohi, EMT trainer, St. John Ambulance, is joining us for this conversation as we get to understand how well you can offer first aid to a young kid in the event that there is danger. Karibu sana.
Asante sana.
I might not be able to explain it the way a medic would,
yes,
but I'm glad that we have you right here.
Yes.
And so we get to understand just what exactly is pediatric first aid.
First aid on its own is just the initial assistance that you give,
yes,
to someone who has suddenly been injured or who has suddenly fallen ill. So when you put the pediatric in front of the first aid,
yes,
it is first aid for children, babies and children. So our focus here is on pediatric first aid, and in the sense that there are people who take care of children,
okay,
from the ages of infancy, from below 1 year to around 10 years. So children come face various emergencies,
right,
while at school, while at play, and even at home, mostly. And you find that most of the people who take care of these children, be it the parents, be it the caregivers or the teachers in school, they may not have the knowledge in terms of first aid to take care of an emergency for a child during an emergency.
Yeah.
So that's where now we come in, and we want to sensitize and the general public on some small techniques and some small things that you can do.
Now that you mentioned teachers and all that, I think it's also important that we just name them and tell them you are the people who would definitely need to understand pediatric first aid. Teachers, who else?
Teachers, because they spend a lot of time with children. Caregivers at home. There are caregivers who, after school, the kid finds the person who's taking care of them before the parent comes home.
Yeah.
And of course now the parents. Very important that they learn pediatric first aid.
Okay.
If not everyone in the household,
okay,
at least one person in the household should know a bit of first aid in case of an emergency. Either to the children or even to an adult, but mostly to the children, because the child cannot take care of themselves.
Yeah.
If, for example, they're bleeding, you may need to deal with that bleeding.
All right. Before
Yes.
we get to know what is covered in the pediatric first aid, many would ask, like you rightfully put it, first aid is first aid. Why pediatric first aid? How different is it now? In as much as we know that it's about children and, of course, in comparison to the adults. But I would say, if I have basic knowledge on first aid, then I can as well incorporate that to the child.
Yes, but what we do, yes, you have basic knowledge in first aid, but when it comes to pediatric first aid, there are some certain things that you may need to focus on, because they are common to children and infants, because by the virtue of them still being in the developmental stage, they aren't, their body organs are not fully formed and such. So you may need to, for example, I could give an example of if you want to resuscitate a child, it is a bit different when dealing with a child than an adult.
Oh, yeah?
There are some certain things that you can do that increase the chance of survival for a child,
okay,
than if you are to do it the same way you do it for an adult. Yes.
All right. So in this case, we say that no matter how careful we are, in most cases, kids are prone to being hurt. And so it's important that we get to understand this. When we're talking about pediatric first aid, how long would one take to understand the most basics, the nitty-gritty details that you're talking about, or, the small things that would be necessary for them to make sure that they take care of a child in the event of an accident?
Actually, when it comes to emergency first aid or pediatric first aid for children, we do the training in 1 day.
Okay. Well,
yes.
1 day is enough.
Yeah, we do the training in 1 day, but we encourage you to do practice over time.
Yes.
Yes, we can lay down the fundamentals in terms of what you need to do in case of an emergency when this happens and such. But emphasis is placed on getting help, getting professional help, and getting this person to a hospital so that they can get more advanced medical help. So the pediatric first aid the focus is on preserving life, preventing the condition from getting worse, and promoting the child's or the infant's recovery.
All right, so in this case, what exactly is covered in pediatric first aid?
What we cover in pediatric first aid is we first deal with life-threatening priorities.
Okay.
We deal with life-threatening priorities in terms of, when we talk about life-threatening priorities, we talk about factors that affect airway, breathing, and the circulation of the child. And then we deal with safety issues in the household or in school. Then we deal with wounds, bumps and bruises, fractures, poisoning, medical conditions such as asthma, anaphylactic shock, which is an allergic reaction. And now we talk about how you can move a casualty, a child from point A to point B.
Okay.
Yes.
All right. I see we have a baby here.
Yes.
At least we should give them a name. He's a man, so most of the times, I've had sessions where I've had conversations with ladies, a lactating month and all that. In most cases, they will name their babies. But since you're a man, I will forgive you for that. So what are we expecting today in terms of practicals and in terms of getting to learn this?
Yes, with my baby here, what I want to show you is how to deal with a baby who's not breathing, and also deal with a baby who is choking, so that we can know those are the key aspects of taking care of children and infants.
Yeah.
And then also we can talk about how to deal with bruises and small minor cuts and such. Yes.
Sometimes there's so much fear, especially in that aspect where the baby is choking. You are doing it, but you do not have the confidence that you're doing the right thing. Are there instances that you can incorporate what you have been taught, what you have learned, yet do it the wrong way? Or cause more damage?
Definitely, because if, for example, you're taking care of your child, you will have a problem in the sense that the anxiety will come into play. So what we encourage guys is just to stay calm, and they can actually take care of their child and not cause harm, because there are certain ways you need to hold the baby so that you do not, can I say, cause further injury. Yes.
All right. So convulsing would be the same as choking? In this, or the first aid would be different?
Convulsing is different from
It's
choking.
different. So of course we'll have to learn some of these things.
Yes.
Kids are delicate, and especially when they're so tiny. So sometimes you're scared, you might even break their ribs and all that. So
definitely.
I guess I leave the stage for you to, first of all, take us through what you have in store for us today.
Sawa, thank you. First of all, when we're teaching guys or when we're training guys how to deal with emergencies, all emergencies, we talk about managing an incident. There's an aspect of where you need to assess the situation, then ensure the safety at the scene, make sure that everyone is safe, yourself included, and then give now emergency procedures, emergency first aid for those who need it, and then get help, call for help, actually call an ambulance so that you can get this person to hospital or this child to hospital. And then now comes aspects of the aftermath. Aftermath are things like informing parents. If you're not the parent of the child, you need to call the parent and tell them that your child has been taken to hospital A and such.
Okay.
So first you manage that incident. It's a short acronym we call AMEGA: assess, make safe, emergency aid, get help, aftermath. And then once you do that, now you can continue now managing the casualty. The first thing that you need to do when managing a casualty is assess for life-threatening conditions. Now, there is something we call Dr. ABC. That is the primary survey. You conduct a primary survey on an infant. Once you conduct a primary survey on an infant, that assesses for any dangers, check whether the casualty is responding, opening the airway of the baby or the child, checking whether they are breathing, and checking whether the blood is flowing, the heart is pumping blood as it should be pumping blood. Yes.
So I see you have a first aid kit.
Yes.
Before we even expound it further, In the event that there's an accident and I probably do not have a first aid kit, then what?
What we do is we improvise. For example, if you do not have a dressing, in the first aid kit you mostly have a dressing. And,
can we have it open and
yes,
see what is inside there?
Definitely. In your
So
first
this is
aid
the kit,
yes. In your first aid kit, you have bandages, which I already took out. You have gloves, which are essential for for taking care of infection and infectious conditions. Things like a thermometer, which you can help to take temperature and such things.
Okay.
And funny enough, you mentioned seizures. Seizures in children occur due to fever.
Okay.
Yes, so those are some of the things that you can use in your first aid kit. So if you do not have a first aid kit, if you do not, for example, have a pair of gloves and you have access to a polythene bag, use a polythene bag. Yes, that helps to prevent from infection.
Yeah.
So if you do not have a bandage, you can use a piece of cloth. You have a handkerchief with you. Use that to prevent bleeding or to protect a wound.
Yeah.
So generally, that the first aid kit is just something that helps to manage various situations that you may come across. And we encourage everyone to have a first aid kit.
Yeah, how expensive can this be for purposes of, it depends?
For example, this first aid kit is 2,200.
With everything inside?
Yes, with everything inside. Even if hata wewe ukiniambia, I can leave it to you.
Okay.
And you give me 2,200.
Patia yeye space yote na hata haizi kusema hata aniachie free. Yes.
But yes, the first aid kit is available at St. John Ambulance, St. John Ambulance offices countrywide. And this is a first aid kit you can use in your car, you can use at your home, and you can use even at the workplace. We have even workplace first aid kits. Yes, that are available on order.
Yes.
Yes.
I'd want to say that I need one, but at a subsidized rate now that I've given you airspace. And you have to commit right here on set so that when we're out of this place, hakuna kusema ati sijui nini ama nini. Yes, it's advisable to have this. And so let's kickstart just getting to understand. This is now the baby. And say what convulsion has occurred. Well, how do you handle them?
Now, this is my baby. First, I told you, Dr. ABC, check for dangers. Are there anything that could cause harm to the casualty? Check for danger, check for response. So when you're dealing with a baby who is this size, below 1 year old, you tap their feet when checking for response. So tap their feet. Baby, you told me I need to give them a name.
Andy, let's call them, let's call Andrew, Andy, let's call them Andy.
Andy Jr.
Andy Jr.
So tap their feet.
Okay.
Andy, can you hear me? Can you hear me? So they're not responding.
Okay.
They're not responding and you're alone, you can try and shout for help.
All right.
You can try and shout for help. Help! And then open the airway. Opening the airway is just slightly tilting the head back and lifting the chin.
All right.
Yes. Just that. What that does, it helps to lift the tongue away from the airway.
So they can't choke.
So that they don't choke.
Okay,
yes.
okay.
So it helps to lift the tongue away from the airway. Once you do that, and be careful when you're dealing with an infant, don't tilt the head too far back.
Okay.
Because what will happen, you might kink the neck. When you kink the neck, that still closes up the airway. Yes.
Okay.
So when you're dealing with an infant, you just tilt the head slightly. Yes. That opens the airway. And then once you open the airway, you need to check whether they are breathing by trying and listening to their breathing and looking at movement.
Okay.
So you do that for around 10 seconds. So you find that if the baby is breathing, you continue and check for their circulation. Now, for circulation for an infant, let me just lift the infant so that you can see. Under the arm, that is where you check the pulse. Under the arm here. So you check the pulse there, check if it is a steady pulse.
Oh yeah, okay.
For an adult, for an adult it's a
whole different thing.
It's different. For an adult, we encourage you to check either the hand or the neck.
Okay.
But for an infant, check under the arm. We call this the brachial pulse.
Okay.
So check the brachial pulse.
How many seconds?
10 seconds.
10 seconds.
Yes, for 10 seconds, and then if circulation is okay, then and the baby is still unconscious, or you can look for any injuries that they may they may have.
Yeah.
So if there are no injuries and they're just unconscious because of probably convulsions, as you mentioned, you need to let the convulsions end. If the convulsions end, what you need to do is place them in the recovery position. Gently support the head. Gently support the head and keep the head lower than the rest of the body.
Okay.
Keep the head lower than the rest of the body. That helps to maintain an open airway. So what happens is that the tongue is away from the airway, and if there are any fluids coming from their mouth, they can easily drain out.
Okay.
Yes. So this is how you support the infant and move with them, take them to hospital.
Okay.
Keep
so you
making
carry
sure
them
that
way all the way.
Yes, making sure that the head is lower than the rest of the body. And as you're carrying and taking them to hospital, you need to keep monitoring every 5 to 10 minutes. Check whether they're still breathing and whether the heart is still pumping. So every 5 to 10 minutes, check. Is my casualty still breathing? Are they still breathing? Good. Let's continue. Keep a record. It's always a good idea if you can actually even record the breathing rate and the pulse rate. That helps to, when you're handing over to the doctor or whoever, it helps them to understand whether the baby is deteriorating or not. Yes. So that is the recovery position for an unconscious but breathing child. If the baby is unconscious and not breathing, there is something else that you need to do.
Unconscious and not breathing.
Yes.
Okay.
They are unconscious and they are also not breathing.
That's dangerous.
Yes. You need to do CPR.
Okay.
So CPR in full is cardiopulmonary resuscitation.
Right.
Yes. So you need to start CPR.
Okay.
Once you start CPR, CPR should continue until you hand them over. So how do we do this CPR? Let me just, same thing.
Okay.
Check for danger, check for response. Baby, they're not responding. So you open the airway and check whether they are breathing. They're not breathing. At this moment, if I have you, for example, who is around, I can tell you, please call an ambulance, call St. John ambulance, tell them to send an ambulance. I have a baby who is unconscious and not breathing, and I'm starting CPR. So in starting CPR for an infant, you first give them 5 rescue breaths. Okay. You give them 5 rescue breaths, which is mouth to mouth and nose. For why do I mean mouth to mouth and nose? It is to cover both their mouth and their nose with your own mouth.
Your mouth.
Yes.
Okay.
With your own mouth. Now, if you do have a resuscitation mask or a shield, you can use it. This helps to prevent infection. Okay. If you have a resuscitation shield, this helps to prevent infection. So you can place it there, open the airway, and then blow.
Okay.
5 times.
All right.
2, 3, 4, 5. So you give them 5 breaths.
You've closed the mouth and the and the nose as
with
well.
With your own mouth.
With your mouth.
Yes. So you shield. You make sure that the air goes into the lungs. You need to see the chest rise slightly. That helps identify that you're giving an effective breath. Okay. We call it an effective breath. The moment you see the chest rise, that is an effective breath. All right. So you give them 5 ventilations. Once you give them 5 ventilations, then you locate the center of the chest. You can use 2 fingers just under the armpit. Okay. Bring them across, straight across the chest. And at the center of the chest here, just below the nipple line, that is where you're going to do chest compressions for your infant. You're going to do 30 chest compressions. Oh, 30. Yes, you're going to do 30 compressions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30. Okay. You complete 30 compressions, and then you go back to giving ventilations. You give 2 ventilations. After 5, 2? Yes. Okay. Initially, you only give 5. All right. The initial, when you're beginning CPR, you give 5 ventilations. And then you continue with 30 chest compressions, and then 2 ventilations. 32, 32, 32. You keep doing that until the baby starts to breathe on their own, or until you hand them over, help arrives. What are the, what many would ask, what is the success rate of a CPR? Um, it is higher than not giving CPR.
Oh, yeah. Okay,
Yes.
well, fair enough.
Yes. So we try to promote the aspect of do not do nothing, do something.
Okay.
Yes. I can't give you statistics
yes,
in
but
terms
this,
of percentages, but doing CPR is definitely more effective than not doing anything. So we encourage guys, the moment you discover that anyone, be it a child, an adult, as long as they are not breathing, you begin CPR immediately. Yes. This is now for children, you do the ventilations, but for adults, nowadays, we concentrate for what we call lay rescue or CPR, we concentrate on the chest compressions for adults.
Okay.
Yes. But for children, concentrate on giving ventilations and compressions.
Yes.
The reason behind that is, for children, mostly their problem is a respiratory problem. That is why you need to give them CPR. They may most likely have a respiratory issue. That's why you're supplementing the oxygen that you're giving them with the chest compressions.
The chest compressions.
Yes.
Okay, well, and of course on that very note, that is on the CPR. I guess it's important that as well we get to understand how then do you deal with a child in the event of that they're choking.
Yes.
I have had my son get, to that level before, and the panic that is there. How do you get yourself, first of all, to calm down and say that I'm with this little boy alone or with this little girl alone, and so I have to relax, calm down, and get into first aid?
Again, that should come naturally. What do I mean by that? You need to understand that you're in an emergency. And the more you panic, the longer it will take for you to assess this casualty. And the chances of survival for this casualty are higher if you begin help immediately.
Okay.
So early help is important. Then early CPR is also important. So once you understand that, to help calm down, you start your help immediately. Once you start that's when now you can begin dealing with your choking baby or choking child.
Even before we get to the choking aspect, how hard should the CPR be? How firm should it be?
It should be firm enough the compression should go down around 4 centimeters for a baby.
Okay.
So it should be hard enough. Remember, this chest is hard. It is hard. So you have to, and you're using only 2 fingers.
Okay.
So you have to do a compression that is firm enough to go down at least 4 centimeters so that you can deliver an effective compression. The idea is to pump blood to go to the brain and the rest of the body. Yes.
All right. Until what age can one then incorporate that? While you say CPR is good for the grown-ups, how different is it now? This is the hand. At least I remember something like this. I cannot quite tell you how it...
For a baby, what we use...
A baby up to what age would you use the
This
fingers?
is for below 1 year old.
Okay.
2 fingers.
Okay.
For a child who between 1 and around 8 years, you use 1 hand.
Okay.
Use 1 hand. And beyond that, now that's when you can use...
The 2
hands.
Okay.
Yes. And for a child, the compression needs to go around 5 centimeters also.
Well,
Yes.
okay.
Yes.
Fair enough. How about we take a short break and then we come back or learn how best we can deal with, choking,
Yes.
as well as some bit of cuts, which is very important. That's the reason why we have lots of bandages. Is it bandages, right?
Yes. Yes.
Okay. After this break. Taking us through, the basics of understanding a pediatric first aid, which is very, very important in the event that, an occurrence plays out and you might need to save the life of the child that is pretty close to you. As, of course, we leave from, or we exit from that aspect of understanding how you can deal with convulsion, I guess one of us who was asking that has their question answered. We get into choking, but even before that, in the event that you realize that, well, you probably pushed so hard and maybe there's a bit of rib fracture, what happens? Are you able to notice that while you're doing it, and so that you go slow on the CPR?
If you notice injury, and if you do notice injury, you have no option but to continue.
Oh, yes?
Yes, you just have to continue. It is better than doing nothing, as I said.
Okay.
So you do not stop CPR.
Yeah.
You only stop CPR if the child starts breathing on their own,
okay,
or until you hand them over to the professionals. Otherwise, if you stop, it means that the heart is no longer pumping blood.
Yes.
And if the heart is not pumping blood, it means the blood is not getting around the body.
Yeah.
And blood is what is transporting oxygen. So something like the brain, if the brain does not receive oxygen within 4 minutes, brain cells will begin to die. And if it takes much longer, up to 10 minutes, from 10 minutes, permanent damage to the brain will occur. That is why we do CPR. The idea of CPR is to ensure that oxygen is circulating to the body cells, most especially to the vital organs, such as the brain.
All right.
Because that is the most essential bit.
Okay.
Yes.
Important.
Yes.
And of course, hapo pengine tunasema they will figure out what happens after that.
Yes. Let the medical professional sort that out.
All right.
Yes.
So choking.
Now, we're dealing with choking. Most of the time, choking occurs in infants. It occurs when they've started eating now solid foods, when you're weaning and such. So, first of all, how you recognize choking in an infant is the color. You can see the color of the lips, they turn blue.
Their lips?
Yes, they may turn blue. They may let out a cough. Try to sound out a cry, but the sound is not coming.
It's not coming out.
Yeah, the sound is not coming out. So, in that instant, you recognize that they're having distress and they're having breathing distress. So you need to act immediately. So the moment you act, what you need to do is give them 5 blows, back blows.
Okay.
And then...
proper ones.
Yes, proper ones. I'll show you. 5 blows, check the mouth. Has the obstruction cleared?
Okay.
The obstruction hasn't cleared, you go back to giving now chest thrusts. Same way we're doing CPR. Same place. You give 5 chest thrusts. Check the mouth again. Is the obstruction in the mouth? If it is, you remove it. If it is not, go back to the blows. So you keep doing that until the obstruction clears or they go unconscious and you need to begin CPR.
Okay.
Yes.
All right.
So, yes. So this is our baby. You realize that they're choking. Immediately you realize that they're choking. What you need to do, support their head.
All right.
You support their head because remember, the neck is very fragile. So support their head. Make sure that the head is lower than the rest of the body.
Okay.
Supported on your thigh.
All right.
Yes. Make sure that the head is lower than the rest of the body and the body is supported on their thigh. And then using the heel of your hand, you can give them up to 5 back blows. 1, 2, 3, 4, 5. It needs to be hard enough so that the obstruction can actually dislodge.
Wow.
So hakuna kusugua.
Serious thing.
Ukibembeleza, what happens is that you're not helping the baby.
Okay.
Yes. Then you turn the baby. Remember the recovery position. You turn the baby, check the mouth if there's any obstruction. If there's any obstruction, you can remove it if you're able to, but do not go fishing for it.
Okay.
Yes, if you're able to remove it, you remove it. If not, and they're still choking, you turn them. Still head supported. Lower than the rest of the body.
That is after you've tried how many blows?
5 back blows.
5 back blows,
yes.
Okay.
If they are still choking, you turn them onto their back. Ensure that your thigh is still providing a firm base. The head is still lower than the rest of the body. Then, using 2 fingers at the center of the chest, same place we're doing CPR, chest compressions. At the center of the chest, you do 5 chest thrusts.
Okay.
1, 2, 3, 4, 5. Excuse me. And then check. You turn them, check the mouth, see whether the obstruction is there. If it is not there, you go back to the 5 back blows.
Okay.
So you keep alternating the blows with the chest thrust until the obstruction clears And you will know that it has cleared if they start crying.
All right.
Yeah. When they start crying, you know they have the air in the lungs to cry.
Okay.
So that is a good sign. Place them in the recovery position, and it's important that you take them to hospital. Anyone who has received back blows and chest thrust, especially for children, needs to be seen by a doctor.
A specialist.
Yes. So once you do that, but if they stop breathing, you start CPR. If they go unconscious because the obstruction has not cleared, they will stop breathing. So you need to start CPR. Call for help immediately and then start CPR.
Ooh. All right. So after that, then there's, let's say, other accidents. There's a cut, there's a burn.
Yes.
How do we help them?
Now,
that one must be the same as how you would help a grown-up.
Yes, that one doesn't change.
That one doesn't change,
That one doesn't change. Your priorities don't change. The idea is to control bleeding and prevent cross-infection.
But even before it gets to that, for a grown-up, in the event they are choking, or because then at this point we're talking about maybe a 10-year-old, and maybe they're choking and they would want to, I mean, you definitely want to help them out. How do you go about that?
It is the same. In terms of theoretically, it is the same. It's only that now the posture of how you're going to do the back blows changes.
Okay, because then you can't hold this grown-up.
Yes, you won't hold them on your thigh.
Yes.
So what happens is that if, for example, they were seated, you would need to, you first encourage them to cough. You know, for a grown-up, you can encourage them to cough. You know, for a baby, you cannot. For a grown-up, you can tell them, try coughing it out. If that does not work, that's when now you resort to the back blows. What happens is that you're going to stand up and lean them forward. Lean them forward and give them 5 sharp blows between the shoulder blades.
Okay.
Yes. If that does not work, you're going to give them abdominal thrusts. For an adult, it is abdominal thrust, not chest thrust. Abdominal thrust. Just above the navel, you give them 5 abdominal thrusts. Some call it the Heimlich maneuver. Yes. Okay.
All right. Now, of course, in the event of a cut and maybe a burn and all that.
Now, in the event of a cut, the idea is to control the bleeding. If it is a minor wound, you just need to wash it first with clean water. Just wash it with clean running water and then cover it with a dressing. We call this an adhesive dressing. If it is a minor wound, a small wound, you can use this adhesive dressing. You know what guys call elastoplast in Kenya. It's just an adhesive. Yes, it's just an adhesive.
So this then means we should also have this inside our first aid kit.
Yes, definitely. It is there because this is almost
like an automatic.
Yes, so wherever you're buying your first aid kit,
make sure that you look out.
You need to check because the first aid kit actually has a list of items that are here. The first aid kit has a list of items that are here. So you need to just check quickly what these items are and whether they are there. Okay. Yes. All right. So you do that. If the wound is somewhere here, once you've cleaned it, you need to cover it. Cover it nice and neat. Like that. And then just let it be for after a while. You can now check whether the wound has healed for a minor wound.
What if it's, now for a deeper one, and maybe it's a bleeding over bleeding
for a deeper wound, you would need to, you won't even wash it first because your priorities now change from preventing infection to controlling bleeding. Yes. Yes. For a minor wound, your priority is to prevent infection because there's not much blood. But for a large wound, you need to control the loss of blood. So what you do, you need to apply pressure first where the wound is. Apply pressure first. Once you apply pressure, then you can get a dressing. You get a dressing and then open up the dressing. This is now a gauze dressing. Okay. This is a gauze dressing. What you can do, cover it nice and tight, and then you can wrap it with a triangular bandage. What we can do is wrap it around the wound so that you can provide pressure. Okay. The applying pressure is what is important to control the loss of blood. Ensure that it is not too tight so that it doesn't cut off blood flow, but it is tight enough to control the loss of blood.
All right.
Yes.
Okay, well, that's amazing. A ban. Or in this case, then it's not applicable.
a burn, you manage it like the minor wound that we were dealing with. The idea of a burn is to cool it first.
Okay,
Yes.
so at this point, you don't use a plaster on a burn?
On a burn, first, you need to cool it.
Cool it first.
Yes, that's your priority.
Yes.
You need to cool it under running water for around 10 minutes.
The different types of burns, I would want to assume. There's that one steam burn, there's, you know, like direct. So first cool it.
Yeah, cool it.
Yes.
Any burn, any type of burn. Actually, the classification is around 6. We have a radiation burn, an electrical burn, a dry burn, scald, chemical burn, and then a cold injury, which is also a type of burn, but now using sub-zero temperatures. So for a burn, the idea is to cool it fast for 10 minutes.
Okay.
The cooling helps to reduce swelling and reduce the possibility also of infection using running water. It is encouraged to use running water. There is a difference between running water and water that is in a bath.
Okay.
Why the difference is that, you know, when you put your hand inside a bath, the water starts becoming warm, because of your warm body temperature.
Okay.
So running water just runs at the temperature that is there, the room temperature or the initial temperature. So cool it under running water for around 10 minutes. Once you cool it, then now you can cover it with a non-stick dressing. A non-stick is a dressing that will, I don't know if I have it here.
Okay.
A dressing that will, yeah, this is also a non-stick dressing. What happens is that there's a pad here in this dressing that helps to cover the wound so that it does not get infected.
Okay.
The idea is also not to prevent cross-infection, to prevent infection of the wound. If you've ever gone to any burn unit in a hospital, they don't just let anyone in, and you don't just let anyone with clothing on, because of the exposed skin has the probability of getting infected very easily.
Okay.
So that is why you cool it and cover it. If you do not have a dressing, a non-stick dressing, you can use a polythene bag. You can use a polythene bag, just cover it, tape it, and take the casualty to hospital. Yes.
All right.
Yes.
So say generally on this first aid or pediatric first aid ways, can you start training this, you know, or can you start training kids on this? Would it be important, say, from at what age?
At St. John, we actually have various St. John units in different institutions, in different primary and high school institutions. So at as early as the age of 6, 7, hapo, we encourage them to start learning first aid. And the emphasis, even on training children, is on the idea of making an emergency phone call.
Okay.
Yes. What you need to say during, to communicate to the emergency services that I have a casualty and I need your help. So that is where the focus starts.
Should be,
from. Yes.
Okay.
We start by encouraging children to understand how to make an emergency phone call. And when making an emergency phone call, actually, even some adults do not understand what needs to be need to be said, because what happens is that the adults will start saying, kujeni hapa tuko na mtu amegongwa na gari.
Yes.
So they haven't told you hapa ni wapi and how many casualties you have and that. So when you're making an emergency phone call, there are things that you need to mention. You need to introduce yourself, say who you are, and give a contact. You need to say why you're calling, and you need to say where you're calling from, an exact location. Usianze kusema niko karibu na hii transformer ya Kenya Power, where is that?
Get it right first.
So you need to give an exact location, confirm that your details are clear, and ask how long these guys will take to get to you, so that you can now decide whether to wait for them. So that information, for children, they can actually understand it very, very, very fast. And even for people who are taking care of children, it is important that when you're relaying information that a child has been hurt, you give the right information to the controller, the person who is answering the phone, so that they know when the ambulance crew is on the way, they know what to expect and the kind of equipment to get ready
Right.
so that at the scene, so as not to waste time.
Okay.
Yes.
All right. So in an ambulance, sometimes it's not always that you get all these equipment. So there are things that would need to incorporate.
No, the equipment is there.
Yes, but
I'm just saying
getting
to get it ready. Yes.
Okay, that's a whole different.
Yes.
I mean, that's why I started by saying, I'm not a medic, and so sometimes
okay.
I might go against what you guys say and all that. So thank you so much for speaking to us this morning. What would be your parting shot as pertaining to what we have learned today?
It is important that every caregiver learns first aid. You can enroll in our courses. We run the course every Saturday at St. John Ambulance Kenya in our various offices, and also in case of an emergency you can contact us. I haven't given you the number. Please do. 0721.
We'll send an invoice, or better yet we'll get first aid kits ahead.
Yeah, the number is 0721 225 285. That's the emergency number for St. John Kenya.
So say it again.
0721 225 285.
All right, and they will get to you.
Yes,
anywhere.
They will get to, the person who answers that phone is a medic. They will sort you out in case of an emergency, and as long as you tell them whatever kind of emergency that you're dealing with.
Okay.
Again, it is important that we have a first aider in every household, especially where there are children. It is important that at least one person is trained in first aid, and it is open to the public for you to sign up with us.
That's true.
Yes.
Thank you so much once again, Andrew Wanjohi, EMT trainer, St. John Ambulance, for speaking to us, and as well giving us a nice session. I guess I have gotten the basics of pediatric first aid.
But you need to sign up for class.
What for? You said it's just one day. Have I not got it?
You need to practice. You need to actually practice.
But now practice would mean a child who's now in danger and I have to save them. Is it not so?
In our class setting, we have scenarios.
All right. I can almost tell you the most basics one. Let me see whether I have gotten something on convulsion.
Choking.
Choking.
Give back blows.
Hivi. Sindio?
Yes.
Alafu unamweka hivi.
On your thigh?
Kwa thigh,
yes.
Na akuwe ameface chini.
Yes. Usishike shingo na mnyonga.
Oh, nishike hapa. Na sasa,
okay, well,
wait a minute, namshika na mkono gani?
Whatever you're comfortable with.
Because ngumi zangu is stronger on this side, so this would be better, and then that, and then you give them 5.
Yes.
In the event that it doesn't work, you come back.
Yes.
See?
Support the head.
Oh, like this way.
Yes,
Kidogo,
yes.
And then you give them the track.
Make sure that the back is supported also.
Opo.
Head lower.
Head lower.
Yes.
Sasa hapo, okay. And then 1, 2, 3. 5.
Yes.
5.
Yes.
Doesn't turn, so you go to this one again.
Yes.
All right. See, at least that one I have gotten something.
You actually have to practice more, but you get the basics.
I've gotten the basics.
Yes.
The basics. Yes. Well, and so much more. Thank me later for that class. But then again, importantly, as Andrew would say, please register for this. You'd get it clearer and better for your own good and for the safety of your kids. Thank you once again for speaking to us, and looking forward to another session where we'll get to learn more on first aid and so much more as pertaining to just first-hand care before you get patients, or before you get people who have been involved in accidents to a specialist or to